Okay. Hello, my practical people, and welcome back to my channel, The Practical Therapist. So, a few weeks ago, I dropped a video that talked about the 5 main areas that are typically assessed when a parent has concerns about their child's development. So, just to recap, here are those 5 areas again: communication skills, cognitive skills, social and emotional skills, fine and gross motor skills, and adaptive skills. So in today's episode, I'm going to talk about several common, I would say fairly common or well-known developmental delays that can affect any of these 5 areas. So please keep in mind that for this video, not all 5 areas have to be affected, but you have to have a negative impact of at least 2 to 3 in order for your child to qualify for services such as speech therapy or occupational therapy. So let's talk about them. The first one is autism. Now, the hallmark of autism is pretty much limited or absent verbal communication or social language skills. But here's an example of when one area can be affected and another one isn't. So let's say a child is diagnosed with autism. They may have adequate cognitive skills because they can problem solve. For example, they have figured out how to unlock their mom's phone to swipe up to their favorite YouTube video. They may also have adequate fine and gross motor skills, meaning that they can jump and run and climb on furniture. But communication would be negatively impacted because they're not using words or gestures to communicate their wants and needs. Also, adaptive skills may be negatively impacted or delayed. The child may run around the house, but they may not be potty trained and they may still wear a diaper. Let's talk about the next one, cerebral palsy. So, cerebral palsy is a neurological disorder that affects the voluntary muscle movements. So, when it comes to speech, a child may have the intent to communicate. However, speech is going to be negatively impacted due to the involuntary control that the child has. The child basically has no voluntary control over their oral musculature, meaning that they may have difficulty voluntarily putting their lips in place to make the B sound, or rounding their lips to make the W sound, or lifting their tongue to the roof of their mouth like such, or like so, for the L sound. Also, adaptive skills could be negatively impacted. So, let's say a child is trying to pick up a fork in order to stab a carrot and then bring that fork with the food to his or her mouth to eat. If the child does not have voluntary control over the muscles in the hand, then their ability to feed themselves, again, that adaptive skill is going to be negatively impacted. But the child's social and emotional skills may be adequate, meaning they smile appropriately when they see family members and other loved ones or other children. Number 3, Down syndrome. So when it comes to Down syndrome, the hallmark of Down syndrome is typically the presentation of the child. So you can typically look at a child with, I would say, a classic case of Down syndrome and tell that that child has some type of syndrome or something that's affecting the look on their face. So when it comes to Down syndrome, in my experience, most children with Down syndrome, their social and emotional skills are fairly well developed. They're friendly, sometimes to a fault with strangers, but overall, they have a happy disposition, and again, they smile and interact appropriately on a social level with loved ones, caregivers, and peers. But let's go back to speech. I am an SLP. Their communication, again, could be negatively impacted due to what we call flaccid muscles. So flaccid or floppy musculature is going to prevent that child from producing precise and intelligible speech. So again, the communicative intent may be there, but the floppy or flaccid musculature may prevent that precise and intelligible speech intelligibility. Also, the physical domain, fine and gross motor skills, again, may be negatively impacted. So, for example, a child with Down syndrome may have trouble opening a jar or opening a bag of chips. Again, if they have those flaccid muscles, then they may not have the strength and dexterity to, for example, pull a bag of chips open or put a small straw into one of those Juicy Juice straw boxes. So again, I just wanted to come before you guys today with a quick video and just give you some examples of common developmental delays that, again, does not have to affect all 5 domains, but mainly 2 or 3 at the most. So if you are having concerns about your child and you're questioning whether they have any problems with their communication, with their fine and gross motor skills, with their adaptive skills, with their social and emotional skills, or with their cognitive skills, definitely come back to this video, review it, play it over and over again, and I hope you find it helpful. I will talk to you guys in my next video. Make sure you like, share, and subscribe. I'll see you soon.